Good morning. So today we'll be actually talking to the owner of Forma. So if you just please like to introduce yourself.
Hello, good morning. My name is Dr. Raj Kumar. I'm the owner of Forma Dental Practice. I've owned a practice for just under 15 years and we've been based at Harley Street for over 11 years. Now, I originally used to do cosmetic dentistry. I used to do lots of veneers. People used to fly down from Edinburgh, Nottingham, even abroad, and this is when we were in the West End about sort of 10 years ago, and I was doing a lot of smile makeover cases. Now, I wanted to improve my skills, so I thought, let's go and get some teaching done from an American cosmetic dentist. So I googled a few names, and there were some very big top dentists in New York who were offering smile makeover courses. So as you do, I googled the dentist and I found a damning website called baddentist.com, and I found lots of cases where dentists have been doing over preparation, cutting down teeth, veneers falling off, and those teeth have been irreparably damaged. So I thought, do I want to go down that route? And I sort of thought long and hard about it. Now, it just so happened that the same month I was invited to an orthodontist practice to see how their practice runs and for me to refer orthodontic cases to them. At the end of the meeting, we were shown a video on Invisalign, a system of clear, invisible plastic braces to straighten teeth. And I thought, this is something I would be very, very interested in doing. So I thought, I always get nervous doing smile makeovers. You never know what the patient's going to think. You can't always guarantee with veneers whether the patient's going to like the colour, the length, the shape, the phonetics, or whether a veneer comes off. And once you get into that realm of doing veneers, you cannot go back. The patient can't go back. So after seeing the video on Invisalign, I booked myself on the course. Now, when I went on the course, it was a 2-day course over a weekend. We were shown how Invisalign works, how it involves 3D scanning and robotic technology to make those braces. So once I'd done the course, I was suddenly a certified Invisalign dentist. Now, my website advertised lots of smile makeover cases. So Monday morning, patient came in and he had teeth that were protruding out of his mouth with large gaps in between them, and he was literally begging me to do veneers. Now I looked at his mouth and I said, look, if your teeth are sticking out and there's big gaps between them, if I put veneers on your teeth, you're going to look a bit like the masked Jim Carrey in the film. And I said, I don't now longer do veneers, I do Invisalign. So I had no cases to show, but I showed him stock cases from Invisalign. He was very excited. He gave me £4,000 and he was my first case. So from that day onwards, which was literally 7.5 years ago, I stopped doing veneer smile makeovers. I can probably count in the last 7.5 years, probably 3 cases out of probably 1,000 patients that have had cosmetic smile makeovers where the veneers were literally being replaced